What if I told you the most powerful medicine in the world wasn't actually a pill you swallow, but a movement you perform? It sounds a bit radical, I know, but this concept is literally reshaping modern healthcare as we know it. Welcome to today's Explainer, recorded on May 6, 2026. We're diving headfirst into the fascinating world of physical medicine and rehabilitation, or PMR. We're going to decode exactly how clinicians use therapeutic exercise. And I'm not just talking about a general recommendation to stay active. We're talking about highly precise, highly targeted medical interventions. Okay, let's dive into this. Here's our roadmap for today. First, exercise as precision medicine. Second, the Fit VP prescription. Third, rewiring the brain. Fourth, restoring balance and breath. Fifth, tools for overall well-being. And finally, the digital rehab frontier.
Section 1. Exercise as precision medicine.
You know, historically, medicine was pretty reactive, just managing symptoms as they popped up. But today, it's completely transitioned to a proactive framework focused entirely on optimizing our functional capacity. To really get this, we have to distinguish between general physical activity, which is basically any movement that burns calories, like taking the stairs, and therapeutic exercise. Therapeutic exercise is a specialized, systematic, and incredibly purposeful intervention. In rehabilitation medicine, we actually classify these exercises into highly specific types based on what they do. For instance, we use range of motion exercises, both passive and active, to preserve joint mobility. We use strengthening exercises, like isometrics where the muscle doesn't change length, or isotonics where it does, to directly combat muscle atrophy. And we prescribe targeted aerobic exercises to build up cardiovascular endurance. Each of these classifications is precisely dosed to fix specific impairments and prevent secondary disabilities.
Section 2. The Fit VP prescription.
Now, what's really interesting about this is that because therapeutic exercise is an absolute clinical necessity, especially for people dealing with aging, injuries, or chronic conditions, it literally has to be dosed just like a pharmaceutical drug. We use the Fit VP model for this. That stands for frequency, intensity, time, type, volume, and progression. The type, or the modality, is incredibly crucial here. A physiatrist picks the exact classification of exercise for a specific disease condition. So, for example, aerobic exercises are absolutely critical for managing cardiovascular disease. Meanwhile, resistance training types using specific isotonic or isokinetic movements are a total game changer for reversing things like sarcopenia and bone density loss in aging patients. And then that carefully planned progression ensures the body keeps adapting without hitting a plateau. And this clinical precision goes right down to the cellular level. The success of any rehab program relies entirely on targeting the body's specific bioenergetic systems. Let's say a patient needs explosive power, like just having the functional strength to stand up from a chair. The clinician is going to heavily target the anaerobic phosphagen system with short, intense bursts of movement. But if the goal is sustained community walking, they'll prescribe aerobic conditioning instead. You literally have to train the correct metabolic pathway to get the functional result you want.
Section 3. Rewiring the brain.
So, movement isn't just about muscles and lungs, right? It is also about harnessing neuroplasticity. That's the central nervous system's incredible, almost magical ability to literally reorganize its structure and function after something like a stroke or a traumatic brain injury. One essential method clinicians use to do this is called proprioceptive neuromuscular facilitation, or PNF. Developed by Herman Kabat, PNF uses these spiral and diagonal patterns that exactly match how we naturally move in our everyday lives. For example, a D1 flexion pattern perfectly mimics the exact motion of reaching up across your body to grab a seatbelt. By actively practicing these integrated movements, therapists leverage something called irradiation. It's this fascinating neurological principle where the contraction of a stronger muscle actually overflows to stimulate a weaker one within the exact same kinetic chain. When treating severe neurological conditions like stroke, two historical approaches really stand out in clinical practice. First, there's neurodevelopmental treatment, also known as the Bobith approach. This relies heavily on the therapist physically handling the patient at key points to inhibit abnormal reflexes. In contrast, you have the motor relearning program, which emphasizes self-monitored, task-specific active practice. Now, while both methodologies are totally foundational, recent studies consistently show that actively practicing functional tasks, like doing a repetitive sit-to-stand transfer, often yields far superior functional independence and daily living outcomes for chronic stroke patients. And that's really all down to the principle of training specificity.
Section 4. Restoring balance and breath.
Moving beyond the brain and muscles, we also have to restore the intricate systems that literally keep us upright and oxygenated. Balance, all by itself, is a remarkably complex sensory-motor task. It requires your brain to constantly integrate what you see, what your inner ear feels, and what your joints sense. It's like a giant puzzle. When you experience vertigo or dizziness, one of those vital systems is failing. And that brings us to sensory reweighting. This is the underlying mechanic of vestibular rehabilitation. Basically, therapists use highly targeted balance exercises to teach the brain how to prioritize reliable sensory inputs and compensate for the broken ones. The end goal? Restoring your overall stability.
So, for an inner ear mechanical issue like BPPV, which is where these tiny calcium crystals get displaced, clinicians actually use canalith repositioning maneuvers to safely and physically move those crystals right back to where they belong. For general dizziness, habituation exercises repeatedly expose the patient to provocative movements to safely desensitize the brain. And moving from the inner ear down to the lungs, pulmonary therapies utilize targeted diaphragm retraining and aerobic breathing exercises. These specific classifications of exercise are incredibly beneficial for patients battling COPD or asthma. It literally gives them the ventilatory efficiency and the breath they desperately need to maintain their overall fitness and, just keep moving.
Section 5. Tools for overall well-being. In the realm of rehabilitation, having overall well-being means possessing the physiological reserve to gracefully handle daily life, as well as unpredictable illnesses. But let's be real, sometimes a patient's pain or frailty is just way too severe for standard active exercise. That is exactly where advanced adjuncts come into play. Clinicians might use manual joint mobilization to actively relieve stiffness, or aquatic therapy, where the physics of water, specifically buoyancy, can reduce joint stress by up to 90%. That allows for safe, pain-free aerobic and strength training. There's also suspension-assisted therapy, which uses slings and bungee cords to completely offload painful joints in a weightless environment. It's amazing because it allows dormant, stabilizing muscles to finally wake up, activate, and begin the journey back to total fitness. When you combine these tools in the different types of exercises we've talked about, you get a comprehensive prescription for overall fitness. A truly holistic dosage doesn't just vaguely tell you to exercise more. No, it perfectly balances our specific exercise classifications. You've got aerobic capacity for cardiovascular health, active strengthening to prevent age-related muscle loss, flexibility for maintaining your functional range of motion, and dynamic balance exercises, like multiplanar stepping, to actively prevent falls. This carefully calibrated combination of therapies is exactly how targeted movement directly translates to longevity and profound well-being, especially in older adults. So the crucial point here is how this exact medical theory translates to a real human life. Take a look at this case study. It details an 87-year-old frail patient who had a history of severe osteoporosis and debilitating falls. By prescribing supervised balance and agility training 5 days a week, and then slowly progressing her to power activities and multiplanar stepping, the clinical team actively and significantly reduced her fall risk. This isn't just theory on a page. This is purposeful movement applied as a highly precise medicine to preserve long-term human independence. It's truly life-changing.
Let's move to Section 6, the digital rehab frontier. The rapid integration of modern technology is completely blowing the doors off how we prescribe and monitor therapeutic exercise. We are entering a brand new frontier. Virtual reality is now creating safe, immersive, task-specific environments that are absolutely perfect for Parkinson's or stroke patients. We also have gamification, which provides the visual rewards and deep motivation patients need to actually perform the thousands of high repetitions required to achieve true neuroplasticity. On top of that, artificial intelligence can provide adaptive difficulty. This means AI automatically adjusts the intensity of a digital exercise based on a patient's real-time biometric data, and the whole shebang can be securely monitored remotely through telerehabilitation.
I want to wrap up today's explainer with this incredibly powerful quote from the literature. Wellness is articulated as a state far more profound than the mere absence of infirmity. It is defined as the functional capacity to engage fully in the variegated spectrum of human life. That right there is the beautiful underlying philosophy of rehabilitation medicine. It's not just about not being sick. It's about having the functional capacity, the strength, the balance, the breath, and the neural pathways to actually live your life to the absolute fullest. Which leaves us with one final thought. We've explored the precise science, the strategic frameworks, and the highly specific classifications of exercises used to restore the human body. So I want you to ask yourself, if movement is the ultimate medicine, what is your exact prescription? Thank you so much for joining me for this explainer, and remember, keep moving with purpose.